And do you regret that March 25th directive that, for those who might forget, it was sending people who could be COVID positive back into nursing homes? Looking back, do you regret that? And let's say you had the opportunity to do it again. God forbid there's not another global pandemic. Would that be a directive you would do again?
Look, again, it's woulda, shoulda, coulda. I mean, these decisions were not made by me. They were made by the health department in consultation with other health officials. But the May 25th admissions policy, which again got so distorted in the press, was something that it said if you had been in a facility that had COVID, where there was COVID positive patients, you could still go back. It still required that there be isolation. It still be required that there be PPE. It still be required that all of these other situations were in place in order to protect patients. And if you're medically stable, which is one of the requirements, if you're medically stable to leave, then the medical belief was you no longer had COVID, and so you weren't actually bringing it back. But these were the nuances in conversation that got lost in the hysteria of it. And so I'm not second guessing the medical experts that made those decisions. And again, every study subsequently that's come out has shown that everywhere from New York to Florida to Texas, it came in with the staff, and it came in, through the healthcare heroes, through no fault of their own, who didn't understand it.
Do you think that this policy, though, accelerated the spread of COVID in the nursing homes?
Look, I'm not a medical expert, but no scientific study has shown that. In fact, it's the opposite. And so again, this is one of those things that's a really easy talking bite for people on Fox News and in the New York Post, and if you want to have a political debate. But the reality is that 11 different states had nearly identical nursing home admissions policy, and there was no difference between those 11 states, including New York, including Republican states that were never at the center of Fox News for the same identical policy, and states that didn't have it, and other countries that didn't have it. And so again, I'm not a medical expert, but every single study that has come out does not point to that.
I do also want to talk about another piece of this, and this is the accusation the Cuomo administration underreported the nursing home deaths. You address this directly in the book. I'll read the quote for you. No one took note that the overall death total was always the same, or that we had always been transparent about the fact that we were counting nursing home deaths as in nursing home and hospital deaths as in hospital. Can you describe this explanation a little more for us?
Sure. So back in March of 2020, when COVID first started and we were getting no direction from the federal government, one of the things they never gave states direction on was how to report deaths. And every day we would do our press conferences and we would come out and we would give the public information. And we would put up on the screen nursing home deaths and hospital deaths. And we were always transparent from day one. The way that we were doing this to the public was that we were having the hospitals report in people who died in hospitals, and the nursing homes reported people in nursing homes. And it wasn't for a month and a half, 2 months later, when the press started asking a different question, which is, what about people who had been in nursing homes and then subsequently went to hospitals and died? And so that was the question that became, again, another political football. And so as I write in the book, we end up putting out a number of different surveys in the spring and in the summer of 2020, asking the nursing homes retroactively, asking them to track down what happened to the patients after they left. And when the first, second, third onslaught of responses came in, it was a forensic nightmare. You had nursing homes saying every single patient who left died of COVID. You had people saying that every single death going back to December of 2019 were COVID patients. You had people giving dates of death in the future. And so in August of 2020, we ended up doing this big audit to try to figure out what the real numbers actually are. And then, bam, we get hit with the subpoena from DOJ, us and 3 other Democratic states, after the governor criticized Trump at a convention speech. It was essentially their payback. He directed the Department of Justice to investigate us. And so we defer to the feds, and we said to the legislature, we need to give the feds what they're asking for. This is a federal investigation. This is serious. We need to deal with that first, and then we will come back to you. And they said, okay. And that was what the hubbub was. It was overall deaths have never been in question. It is not questioned that from the very beginning we were very transparent that we were reporting nursing home deaths to nursing homes, hospital deaths to hospitals for pure ease and reliability. And again, this is one of those things that if we had known that number would have become so politicized and so weaponized, then back in March of 2020, when we were making decisions, we would have just said this is how we should give the accounting. If we had known, 6 months later what the results of that.
This was a national story for months, as you know, and as you detail in the book, you lived it. You're saying there was nothing nefarious about the underreporting of the numbers. The New York
it wasn't underreporting. It was, we always said there's hospital deaths and nursing home deaths. And then they started to ask a second question of what about the people who left the nursing homes?
So no, there was never anything nefarious. We actually gave deference to the Department of Justice in what was a totally politically motivated report directed by the White House into Donald Trump's political nemesis in his own mind. And then you fast forward to July of 2021, and DOJ actually sends us a letter confirming the numbers you gave us were proper, and there's nothing in the numbers that indicates there should be an investigation. But by then, it was too late. The die had been cast, the narrative had been hardened. This has been months of unrelenting national news cycles. And then in July of 2021, the Department of Justice comes out with this letter, and I think it was a box on page 12 of the New York Post, and everyone just moved on. And so no, there was never anything nefarious about this.
The New York comptroller did say that the Cuomo administration misled the public when it comes to these numbers. So you're refuting that. You're saying that is not true. That is not what happened.
That is not true. It's not what happened. And if that were true, then I think the Department of Justice would have had something different to say. You've got to remember the comptroller's a politician too.
But he's a Democrat, right? But you do come at Democrats as well in the book. Can you talk a little bit about that?
Just because someone's a Democrat, I mean, LBJ famously said the only difference between cannibals and Democrats is that cannibals, don't eat their own. So there's no difference. The Democratic Party is happy to, ask Al Franken about the Democratic Party. So I don't think that anyone could say, oh, he's a Democratic comptroller. That's not really how it works.